Good afternoon and welcome to our presentation focusing on mHealth telecare for patients with diabetes mellitus, the ProEmpower experience. My name is Strahil Birov. I'm a research consultant at Empirica Technology Research in Bonn, Germany, and I'm joined today by my colleague, Ozan.
Good afternoon. This is Ozan Beyhan from Ministry of Health of Turkey. I'm a project consultant at General Directorate of Health Information Systems, the unit which coordinated ProEmpower project on behalf of the ministry.
We cannot, as you can see, we cannot be present. This is a recording, so we're talking to you from the past. A week ago, we took this recording, so there will not be possibilities to answer questions directly, but feel free to go to the website that you can see here, proempower-pcp.eu, where you can see more information about the project and also get into contact with us. So we're very happy that we can join you virtually via recording today, and we'd like to present to you our experiences related to telemedicine and telecare, which we've collected over the last several years. We will go through some background about the ProEmpower project in the context of the diabetes solutions that were developed within the project. We'll briefly also present the two solutions that were fully developed and tested, as well as the results of those tests and pilots. Ozan himself, as a procurer, will be able to share some experiences, and we also have the experience of another procurer which is not present, and we'll conclude hopefully within about 15 minutes. So with that, I give the word to Ozan.
Thank you, Strahil. Thank you also very much for making room for us today, and many thanks to the organizers as well as Alexander Berler from Gnomon for the kind invitation. Next slide, please, Strahil. Today, as my colleague Strahil said, we would like to present you our project ProEmpower, the full title of which is Pre-Commercial Procurement of Innovative ICT for Patient Empowerment and Self-Management for Patients with Type 2 Diabetes. We started the project in October 2016 and completed it in September 2020 after a 48-month project duration. It's a PCP, a pre-commercial procurement project funded by the European Commission's Horizon 2020 program. It has a budget of 4,280,000 euros, 3 million of which was the procurement budget. In ProEmpower, we were 11 partners from 6 countries, and 4 of these partners were the procurers of the project. The project was also supported by an external advisory board. The region of the procurers in the project are inhabited by a big population, of which over 12 million have diabetes. Next slide, please. What is in the focus of ProEmpower is the chronic disease of diabetes, as our motivation was the fact that the procurers' care systems are facing an increasing prevalence of diabetes. The disease is expected to grow globally from 8.8% in 2015 to 10.4% in 2040 if no effective countermeasures are put in place. Furthermore, diabetes is seen more and more in younger years, but also it's increasing among older population, with the age group 80 and higher seeing a strong onset of diabetes. Next slide, please. The costs associated with diabetes include increased use of healthcare services, loss of productivity and disability, and consequently diabetes causes a large economic burden on individuals and families, and on a much larger scale, national health systems and countries. These are among the many common problems faced by the buyers group of the project. Next slide, please. We therefore came up with this project ProEmpower in order to initiate an investment up to 3 million euros in R&D procurement of a personalized diabetes management solution to support patients with type 2 diabetes. In the buyers group, we are 4 countries from the Mediterranean region mainly, where the prevalence and incidence of diabetes is quite high, namely Ministry of Health of Turkey, shared services of Ministry of Health of Portugal, Murcia Health Services from Spain, and Campania region of Italy. Next slide, please. We addressed several unmet needs in ProEmpower, from the fact that healthcare systems in the world are reactive and fragmented, to the fact that patients are lacking ownership, and also current treatment of diabetes patients are proving to be rather ineffective. And there are several other key challenge areas where we thought there were room for development, such as all the green tiles you see in the projection. Next slide, please. ProEmpower was an innovation procurement project, and the tool we used is pre-commercial procurement, shortly known as PCP. In PCP projects, the procurers, in our case healthcare providers, invest in R&D activities for products and services which are not available in the market yet and which address their unmet needs. Then, once procured for R&D, selected suppliers develop solutions called for through an open call and followed by competitive phases of R&D, which are solution design, prototype development, and pilot testing, which all occur in consecutive phases you see on the screen. Phase 1 is solution design, phase 2 is prototype development, and phase 3 is the pilot phase, when the developed systems are tested in real-life conditions. Next slide, please. In our PCP project, ProEmpower, we published a worldwide call for tenders for innovation procurement, which was launched in January 2018, seeking innovative approaches to diabetes care and management. 15 offers were submitted to the call, 4 by single entities and 11 as joint tenders, also known as consortia of suppliers, and 13 of these offers were led by SMEs. Next slide, please. In 3 competitive phases, the best solutions were selected, leading to the full development and testing in real conditions of the 2 solutions led by SMEs from Greece and Italy. On the projection, you see the 5 solutions or solution providers who were selected to take part in phase 1 of the project, prototype development. After the competitive phases of 1 and 2, phase 3 was concluded with 2 solutions, namely DiaWatch, developed by a consortium led by Take4Care from Italy, and DM4All, developed by a consortium led by Bugmann from Greece. Next slide, please. Yeah, now I leave the floor to my colleague Strahil for a more detailed description of these solutions. Thank you, Strahil.
Thank you, Ozan. Well, I'll be very brief because obviously these are not solutions developed by us, but DM4All, as Ozan mentioned, is developed by a consortium led by Bugmann Informatics from Greece and with several other partners from across Europe. And what DM4All is offering is a full solution and a service that comprises different components. So you see them here: drug-to-drug interaction, educational platform, clinical decision support system. There are both interfaces for patients and for the healthcare professionals responsible for their treatment and care. There are different wearable devices and medical devices that are involved in the solution, allowing for a seamless flow of data and availability of this data to both stakeholders, allowing them also to discuss the results and agree on goals through a shared care plan. The diabetes monitoring for the professionals has the aims to increase the efficiency of the healthcare professionals, to provide them with predictive, proactive analytics that help them make informed decisions, improve collaboration also between the healthcare professionals, nurses, and specialists. It allows for remote communication and monitoring and clinical decision support, whereas the patients, they would receive the solution in the form of an application on their smartphone where they have the shared care plan, which allows for agreeing goals with their healthcare professionals. It has different community aspects and training aspects which empower the patients to continuously monitor their diabetes and react on changes. So obviously the solution is very complicated, and these are just the overviews for DM4O. Similarly, DiaWatch has a similar approach where they have different components, a sensing system platform that you can see here, as well as applications and interfaces for the patients and healthcare professionals. Again, they're also using different devices, and the overall idea is that the system, the ICT system, supports the full process of diabetes management of the 4 procurers in the project. For more information, you can also see for each of them at the bottom their own websites with even more information. So let's talk a bit about the pilots, because as Ozan said, over the course of 3 different phases, which is, I believe, more than 2 years, these tools have been developed, tested with end users in prototypes, and finally also piloted in real life conditions. So the piloting happened in the phase, the PCP phase number 3 that you can see here. And how it happened is that for each solution, because we had 2 solutions and 4 pilot sites, each solution was tested by the pilot site with 50 patients. So 1 pilot site with 50 patients for DM4O, 50 for DiaWatch, 100, and then this for all the 4 procurers. So in total, we had 400 patients and about 82 healthcare professionals involved. You can see the periods of piloting here. They differ a bit from pilot site to pilot site, but in total, we aimed to have at least 8 months of piloting per pilot site. And you can see also in red the fact that during the middle of the piloting phase, actually the COVID-19 pandemic happened, and there were also lockdowns and other measures which obviously influenced a bit the results. But I guess that was also a challenge for the systems. That's the idea behind it with remote and telemonitoring, that they are able to cope in these kinds of situations. And we'll see later on that this indeed happened, and the solutions were appreciated by both the patients and the healthcare professionals. So during this piloting, we monitored different evaluation indicators, different parameters before and after the pilot site duration. The glycemic control, HbA1c, blood pressure, body weight were some clinical data that we monitored, but we also collected non-clinical data such as quality of life, physical activity, usability and satisfaction of the service, etc. There are quite comprehensive data that will be published on the website very soon. We expect this to happen in the beginning of next year, but here already we can share some of them with you, the most interesting ones, starting with glycemic control. Looking at the pilot data, again, we had 8 different pilot sites, 2 solutions and 4 pilot sites. So we can see that the HbA1c values significantly dropped for 5 out of the 8 pilot sites. You can see also the differences here for Turkey, Portugal, Italy, and the Spanish pilot site per solution. If we only look at participants whose baseline values were higher than 7%, so they were poorly managed to start with, the difference is even bigger, and the significance also applies to 6 out of 8 trials. However, we didn't want to focus only on poorly managed patients, because this is the process of the R&D, so we have to be open to ideas and see whether the solution works as well also for all kinds of groups, to be able to narrow it down. Also, systolic blood pressure, you can see some data here. There were significant reductions in systolic blood pressure in all of the trials, and this is also a positive outcome, a clinical outcome. In terms of usability, satisfaction, and usefulness, we asked the participating patients and healthcare professionals what they thought about the solutions. So different parameters such as experience with the solution, satisfaction, ability to get along with diabetes using the solution, whether it was worth the effort involved, overall usability. And you can see here that overall both solutions scored quite high, or rated quite positive, with some small differences between them, but overall both solutions were welcomed, and in terms of usability we see some high results in both groups. To summarize the pilot outcomes, we observed reduction in HbA1c values and systolic blood pressure values. There was slight improvements in patients' perception of their disease. The piloting period is 8 months, so obviously if we have more time and data, we might have also more conclusive results. What we focused on in the project was we set up a technology trial. It wasn't a clinical trial, so we didn't have, for example, a control group. But going forward, we believe that these are very promising results, and probably with a follow-up clinical trial, they can be also confirmed. And yeah, that would be the summary of the results. So Ozan, I give back to you to just report on your side, you as a procurer, as a healthcare provider, your experience with using the two solutions.
Thank you, Strahil. Now I would like to briefly present you with our experience in ProEmpower project, more specifically what we experienced in the pilot and the lessons we learned. We carried out ProEmpower pilot in Ümraniye Research and Training Hospital in Istanbul. The pilot was carried out in internal diseases clinic with a team of 10 researchers. The pilot started in July 2019 and ended in July 2020, but this 13-month period is the duration of the two solutions with different time spans, who both achieved at least an 8-month piloting. 100 patients with previously diagnosed diabetes type 2 were followed, 50 for each solution. And one of the things we paid attention while enrolling the patients was technology literacy or technology friendliness, so that there would not be any or not a lot of resistance to use novel technologies. Next slide, please. This is our team. In the picture, you see some of them. The ProEmpower pilot team was led by Dr. Sema Basat, who is the clinic chief of internal diseases, who is an internist and who is also a professor who lectures in the training hospital. We had 2 other internists and professors in the team, 1 other internist, 4 assistant specialists, 1 registered nurse, and 1 registered dietitian. One of these assistant specialists, Dr. Gizem Najak, completed her internal medicine thesis on ProEmpower, and she's an internist now. It is also my pleasure to say that our team consisted of 7 female researchers and 3 male researchers. The majority of the team was female researchers, led by a female lead researcher. Next slide, please. We learned many lessons from ProEmpower, but because of time limits, allow me to focus on some key ones, some key lessons. During the remote follow-up of patients, technical problems were frequent. The team needed continuous technical support, and this showed us the importance of a help desk. Good thing is we had already thought about this, and this challenge was addressed with the provision of a help desk. Healthcare professionals needed extra time to use the systems. There may be nothing surprising about this, but the lesson we learned for the future is that we should prepare a good change management strategy, a change management that will be welcomed by the healthcare professionals in terms of time management and payment. Patients' follow-up, treatment, and prescriptions were supported remotely, which showed us that e-health technologies are a great means to close gaps. By gaps, I mean both the deficiencies of the healthcare system and also the physical gaps between the doctor and the patient. Most of the patients were happy to be in this practice. Metabolic control was not impaired throughout the pilot, even in times of the pandemic, thanks to the shared care plan between the doctor and the patient and the continuous monitoring without the patient having to come to the clinic for regular visits. Another important lesson is that none of our ProEmpower patients caught COVID-19. This may not be a scientific indicator. There may be other dynamics behind this, but still, one of the reasons we thought was the fact that our ProEmpower patients did not have to go to the polyclinic examinations during the pandemic, as they were already in touch with their doctors on their applications. Next slide, please. And ProEmpower and its objectives are perfectly in line with the ministry's objectives. We have a strategic plan published every 4 or 5 years that defines our midterm roadmap. The current strategic plan defines development and procurement of applications for monitoring and managing chronic diseases by 2023. In order to achieve this goal, we already procured a doctor interface for what we call chronic disease management system. The system of Turkey entered into practice last year as a pilot operation and were tested in 4 cities. The system provides the family physicians with a decision support system which warns the doctor who they will examine when and in what intervals. The decision support system does this thanks to its ability to analyze the patient's health records and family history. Then the doctor contacts the patient and calls them over to the primary clinic for regular checks. The disease covered are diabetes, hypertension, cardiovascular diseases, chronic kidney failure, stroke, and geriatric diseases. Although the system is technically ready to be used as a countrywide operation, the large-scale rollout is on hold due to legislative framework, in particular due to pending updates on the regulation of the payment systems to the doctors. The system currently does not have an interface for the patient, therefore it doesn't come with a shared care plan, but it is the midterm plan of Ministry of Health of Turkey to integrate a patient interface into e-Nabız, the personal health record system of Turkey, and connect the patient and their doctor on a shared care plan, where a ProEmpower solution will be required to cover a gap is here. So what will be done in the upcoming years is the procurement of a shared care plan. Next slide, please.
Thank you, Ozan. Another example we wanted to give was just another procurer, our colleagues from Murcia in Spain, who also participated with 2 different pilot sites that you can see here. One pilot site was one healthcare center, which focused on 50 patients in DM4O, and another one that focused on the solution DiaWatch being tested. So they also had quite the team of physicians and nurses, in total more than 30 professionals participating. They had also some interesting lessons learned. One of them is it's not about blood test, it is about lifestyle. So they approached this a bit more general because they saw that the benefits from DiaWatch and DM4O are not just for patients with diabetes, but the underlying risk factors such as being overweight are also part of the lifestyle, and that's why these kinds of solutions such as DM4O and DiaWatch, which involve wearables and constant feedback, allow for many different things to happen, not just for your diabetes to be managed, but also physical activity, diet, etc. So they also recognize the importance of change management, and automatic recording, which is made possible only because both solutions were integrated with the existing systems of the procurers. And they showed also that it's good. It was good that the tool was present and available during the COVID-19 period. And some examples here of positive outcomes of patients and professionals. You know, they saw people that have been empowered and their motivation has been raised. They also saw patients who do not require insulin anymore, which is a great success, and people who were just, you know, staying fit, which is, again, beyond diabetes. It could be, the solutions could be applicable also to other areas, disease areas and conditions. Similarly, also the healthcare professionals found the solutions useful and appreciated that their workload is more efficient thanks to avoiding unnecessary visits, especially during the pandemic, which was not possible to happen. So yeah, just to conclude, I will start. We think that the concept of pre-commercial procurement, which is rather new, it is being done on an international level, but we are also aware of some regions and countries also applying PCP on a national and regional level. We do think it's a useful instrument to stimulate the development of new solutions. And the important thing is those solutions are driven by the so-called demand side, by the healthcare providers, compared to just one big healthcare firm developing something without taking the needs of the procurers into account. The two solutions have been tested. This was a technology trial, as we mentioned. The results are promising. We know that both suppliers are working on further improving the solutions, and they also aim to offer them commercially in 2021. So keep track of it on the website about any updates. The solutions proved especially important during the COVID pandemic. That's a given, and I think this will be also part of your discussion in the meeting. And the ProEmpower procurers, as Ozan gave an example with Ministry of Health of Turkey, are currently exploring possible large-scale implementations of solutions or parts of the solutions into their healthcare systems. Ozan, do you want to add anything?
No, Strahil, I think you covered this perfectly. Thank you.
Then we'd like to thank you for your attention. We hope that you have a productive remaining rest of the meeting and the workshop. And yes, Ozan.
Yep, thank you once again. And I also wish all the participants, speakers, moderators, and organizers a good conference. Thank you so much.